Hi, I'm Sarah Cervillo, Certified Professional Midwife and the founder of Heaven Sent Homebirth. Today we are talking about a question I get all the time. Is homebirth really safe? As a midwife, a mother, a grandmother, a woman of faith, I want to give you an honest and balanced answer. The truth is, when done with a licensed midwife, a healthy pregnancy, low-risk mom, it is a very safe and evidence-based choice. Large studies show that planned home birth with trained providers have similar or even better outcomes with fewer interventions than hospitals. A 2014 US study, and these are MANA stats, I believe. You can look up in below the show notes. That'll show you everything that you need to know about these studies. A 2014 US study of over 16,000 home births, that is a lot of home births, found very low rates of cesarean, only 5.2%. The 2011 UK birthplace study found that for second-time moms, home birth was just as safe as hospital birth. There was a global 2019 study published in The Lancet that showed no increased risk for perinatal health or neonatal health for moms or babies. This is for planned home births with skilled midwives. And I think that's the big difference. If you're talking about the risks of home birth with someone who maybe hasn't had a lot of medical training or an unassisted birth, the stats aren't the same. Anytime you start adding a skilled birth attendant, you reduce any of those risks. Of course, none of this means that home birth is risk-free, but neither is hospital birth. As midwives, we don't just show up with herbs and essential oils. We come with equipment. We bring a Doppler to listen to your baby's heart tones, carry medications for hemorrhage, we carry oxygen for resuscitation, we carry suturing supplies, and what our special equipment is really our wisdom, is really the fact that home birth midwives see natural birth day in and day out. That is all that we see. So when there are nuances to natural birth, things that, maybe fall outside of the textbook example of what labor looks like, we still know whether or not that is a variation of normal or if it's something to be investigated. We believe in your body, we trust in God's design, and we walk with you every step of the way. And sometimes people ask, well, what happens if something does go wrong? It's a valid question. The good news is we're trained for those. That's really why we're there. We're there to be that safety net. We're someone with medical training that can make those calls and can do the things when emergencies arise. So we're constantly assessing labor. If something strays from normal, we don't hesitate to transfer to the hospital. Our threshold for what we deal with at home is lower than a hospital. The hospital, because they have a surgical unit down the hallway, they can push the envelope a little bit further than us. We are looking out for the abnormal. So if we start to see that something is abnormal, we try to treat that as quickly and address it as quickly as possible. And if it doesn't resolve, we go to the hospital. We don't wait until babies crash. If there is any inkling that there is fetal distress, we are immediately trying to address it by position changes or, maybe mom is super fatigued, but we address it. The good news is that most transfers happen calmly. Because of the equipment that we carry, because of the training that we have, we're usually able to stabilize people. We just need longer term care. If we're resuscitating a baby and they need long-term respiratory support, we just can't stay home for that. If someone is bleeding, we can address that. But if they got to the point where, say, maybe they need blood products or they need to be monitored for a longer period of time, those are the times when we are usually going to the hospital. It's very uncommon that we have a serious problem that we can't stabilize a person before we even make it to the hospital. And honestly, most transfers are just for rest due to long labors. They're not for emergencies. And we do continue to support you in the hospital. So in my practice, I will usually go with the client to the hospital. We check you in, I give a report, I make sure that all of your medical records are sent to the provider. And we usually don't leave until there's a plan in place. And then we're still on call for you. So if any questions arise, maybe you want to run something past me. I've known you your entire pregnancy. I know what your birth plan is. I know what, your wishes and desires are for your birth. Sometimes I can just be a good sounding board or give you advice based on what preferences you've told me you have. And who isn't a good candidate for a home birth. So what does low risk even mean? What would be considered high risk? So in my practice, high risk would mean anybody with a serious health impairment or disease, especially if it's uncontrolled. So like hypertension is one, chronic hypertension. So like if you have hypertension before you are pregnant, you are not a good candidate for home birth. If you have thyroid problems that can't be taken care of with medication, so if it's uncontrolled, home birth is not a great choice. If you have diabetes, especially type 1 or uncontrolled type 2, you're not a good candidate for a home birth. Another thing to consider about whether or not home birth is a safe option for you is your vicinity to a nearby facility. If you live out in the middle of nowhere and have volunteer firefighters as your EMS service, if you're, more than 30 minutes away from a hospital, it's not that it risks you completely out of having a home birth, but it is something that you should consider heavily. A lot of times, if it's a small hospital, especially that, is the closest to you, they don't have a maternity floor. They won't be able to do some of the services that are necessary if an emergency does arise. So what happens is then we transfer to the nearest hospital because that's what we should do. Then they are life flighting you out to a more metro hospital. Sometimes that's just a lot. Even if a person is stable, it's still kind of traumatic to go through, to have to, go to a small hospital and then be flighted to a bigger one. If you do find that you're uncomfortable with that distance, I would just consider maybe driving into town, maybe staying at a friend or family member's house and having your baby. Some people will do a hotel or an Airbnb, or if it's available in your area, consider a birth center. So is home birth safe? Yes, with a low-risk pregnancy and a skilled birth attendant. If you're feeling drawn to home birth but you're unsure, it's a great idea to set up a consultation with a midwife and talk about your health history, see if you're a good candidate for home birth, and just have all of your questions answered. Drop your questions in the comments, subscribe for more Christian midwifery content, and check the description for links to the studies that I mentioned in this video. Have a great day.